I'm Dr. Suman Singh, Senior Obstetrician and Gynecologist at Birthright Rainbow Hospital, Banagata Road. And I think by now you have reached the final phase of your pregnancy journey and you're about to welcome your wonderful angel into this world. I'm sure there are a lot of questions in your mind, a lot of anxiety, excitement, and joy about how this journey is going to be. So let me help you with a few pointers to make it more seamless. If you've already been given the list of things that you need to pack, it'll be a good idea to go through the list now. Make sure that you have all your documents in place, check your Aadhaar card, check your insurance papers, and keep your file organized. So next, when to come to the hospital. So we tell our patients that when they have contractions, that means they'll have tightening of the abdomen, which happen once in 10 to 15 minutes, that will be a good time to start driving. Or if any time there is any bleeding or leaking, or if the movements of the baby are less, then you will have to come to the hospital. Okay, when you're in labor, when you're getting contractions, don't panic. Labor takes a lot of time to happen. So when you come to the hospital, you will have to report to the receptionist on the ground floor, and they will put you to the concerned duty doctor, and she will take over the case. She will take your history, she will examine you, she will also do the internal check, and then she will update us about your progress in labor. So we will know how frequently you're getting your contractions, how much is your dilatation. There's an NST test that is done and the baby's heartbeat is checked. After that, the labor is monitored and the progress is seen. Now, once you are around 3 to 4 centimeters dilated, then there are a couple of things that they will do. So they will give an enema, so post which you will be on a liquid diet. And if you are getting good contractions on your own, then that is fine. Otherwise, we will start a syntocinon drip so that you get at least 3 to 4 contractions in 10 minutes. Once you're more than 3 to 4 centimeters dilated, you can also opt for an epidural analgesia for pain relief in labor. The advantage is that you're very comfortable in labor. The downside is that sometimes the chances of forceps or vacuum deliveries may increase. If you have booked for stem cell, it is a good idea to carry your kit along with you when you go to the labor room and inform the nurse so that she is handing it over to us at the time of delivery. We always encourage husbands to be there in the delivery room so that they can cheer their wives during the delivery process. And even if in case it is a cesarean, we do wish for the husbands to be inside so that they can take part during this delivery process. It's always a very precious moment to deliver a baby as a couple. It's one of your precious memories, and this is a good time for you to take plenty of pictures and create those memories for yourselves. After delivery, we encourage you to feed the baby in the golden hour. That is very important to establish successful breastfeeding for the baby. And the woman is kept in the delivery room for 2 hours, or if there is a cesarean, then she is kept in the post-op recovery for 2 hours, and then she is shifted back to the wards, and then the further care happens in the wards. So this overall will be your journey in the hospital. When you're in the hospital, use the time in the hospital to learn from the staff about the correct way to hold the baby, to feed the baby, to clean the baby, and to swaddle the baby. Gain your confidence to handle your baby so that when you go home, you're able to manage your baby well. Wishing you a safe and a very pleasant delivery. Any questions, you can always reach out to us. We're here to help you. Thank you.